I am Dr. Jocelyn, and today I am going to debunk a myth that has gone viral. Wash your member with baking soda and the change is immediate. I tell you this clearly, respectfully, and straightforwardly. Baking soda is not a magic wand for male intimate hygiene. In fact, using it in such a delicate area can irritate, disrupt the skin, and in some cases, worsen what you are trying to fix. My purpose in this video is to provide you with a simple, safe, and effective method for daily care that does produce an immediate change. Comfort, real freshness, absence of itching, and skin that breathes without turning red. I will explain why baking soda became popular, what risks it has, what to do instead, how to clean properly with clear and easy steps, and what signs to look for to seek professional help. Everything in straightforward language, without unnecessary technicalities, and specially designed for men aged 40, 50, and 60 who want to take care of their intimate health with practical criteria. For months, I have received questions with the same promise. I was told that baking soda neutralizes odors, lowers pH, removes fungi, and leaves everything spotless. It sounds convincing because baking soda is cheap, is found in the kitchen, and seems natural. But natural does not mean suitable for any part of the body. The skin of the glands and the foreskin, if you have one, is not the same as that of the elbow. It is thin skin with abundant nerve endings, its own microbiota, and a subtle balance of moisture and fat. Altering that balance with homemade chemicals, strong or abrasive, can lead to microcracks, dryness, burning, and paradoxically, more bad odor over time due to irritation. The immediacy you feel after a friction with baking soda is often a false sense of cleanliness that actually corresponds to dry skin and saturated receptors. Genuine well-being feels different. Freshness without tightness, no itching, no burning, absence of white patches or redness. So, if baking soda isn't the solution, what does work? I'm going to give you a method that I apply with my intimate wellness patients, the clean skin method. I call it that because each letter reminds you of a specific and gentle action you can apply today. First, I want to explain to you in the first person why this proposal generates immediate changes when done correctly. It respects the skin's pH, eliminates residues that produce odor, sweat, urine, remnants of lubricants or condoms. It reduces the friction that irritates, improves microcirculation with warm water, and leaves a natural protective barrier intact. There's no magic, just simple physiology applied with common sense. But first, the problem as it occurs in real life. Many men tell me they notice a strong odor at the end of the day, mild itching that comes and goes, dry skin after baths, or white patches that form if they don't clean vigorously. Some of these situations are due to overly aggressive hygiene habits, scented soaps, rough sponges, very hot water, harsh drying, or now baking soda paste. Other times it's the opposite, insufficient hygiene, especially if there is a foreskin, leading to the accumulation of smegma under the fold. The solution is not extremes, it is precision. Neither scrubbing with homemade chemicals nor leaving it to chance. Intimate skin requires three things: gentle and regular cleaning, proper drying, and intelligent monitoring of warning signs. Let's get to the core. I present to you the clean skin method in 8 steps. Do it as I describe, and we will evaluate the results together in a week. First step, prepare the environment. Warm water, not hot, good lighting, and your hands with short, clean nails. If you use a shower, avoid high-pressure jets pointing directly at the glands. Prefer that the water falls and you guide it with your hand. If you are at the sink, use a cup to pour water gently. This detail avoids the aggression of pressure that irritates. Second step, gentle inspection. Before washing, observe the skin. Is there redness, cracks, adherent white patches, intense bad odor, yellowish discharge, or pain? If the answer is yes, note it mentally to observe after washing. The inspection is not paranoia. It is information that saves you problems. Third step, correct exposure. If you have a foreskin, gently retract it to reveal the glands. If there is phimosis and the fold does not retract without pain, do not force it. Wash as far as comfortable. Violence at this point creates micro-injuries that then burn. If you are circumcised, this step does not apply, but still check folds and grooves where sweat accumulates. Fourth step, initial rinse only with warm water. Let the water run and use your hand to remove visible remnants of smegma, sweat, or lubricants. Do not use sponges or fibers. The thin skin is cared for with an open hand and gentle contact. Fifth step, cleaning with a mild agent, optional and strategic. If you work a lot, sweat, or use condoms or lubricants, a mild, fragrance-free, and dye-free cleanser formulated for sensitive skin can help. A pea-sized drop diluted in water in the palm is enough. Distribute with your hand on the glands, the balanopreputual groove, and if there is a foreskin, both inside and outside. Massage with circular movements without rubbing as if it were a pan. 45 seconds is enough. If one day there is no sweat or special residues, warm water alone is sufficient. The skin appreciates breaks from surfactants. Sixth step, abundant rinse. Remove any trace of cleaner. Soap residue causes dryness and subsequent itching. Let the water wash everything away. If you notice it's too slippery, you're probably leaving soap behind. Rinse thoroughly with water. Seventh step, smart drying. This step is crucial. Dry with a soft towel or paper towel without rubbing. Use gentle touches, absorbing. Make sure to dry the groove, and if you have a foreskin, retract it a bit to gently dry the inside. Then cover the glands again. Dry skin and no prolonged friction prevent fungi and maceration. Eighth step, air and fabric. Let it air out for a minute before dressing. Then choose cotton underwear or breathable fibers. Avoid fabrics that trap moisture for hours. If you exercise, change your underwear afterward. This simple decision reduces odor and itching more than any trick. That's the method. And we don't need baking soda. I'll explain why, precisely and in everyday terms. Baking soda is alkaline. The surface of the skin, including the intimate areas, works best in a mild acidity range that acts as a natural defense against opportunistic microorganisms. Suddenly raising the pH with baking soda disrupts that defense. In the short term, you may feel clean because you've stripped away oil and moisture. In the medium term, it dries out, cracks, and reddens. Some people say, it removed the odor. Yes, just like alcohol does on your hands until it leaves your skin like paper. And when the barrier is damaged, any friction irritates, any substance burns, and the odor returns because the skin becomes inflamed. The real solution is called balance. Removing what is excessive without destroying what protects. I want to give you a yes and no map that saves you doubts in male intimate hygiene. Yes, lukewarm water, mild unscented cleanser when needed, clean hands, drying by patting, breathable underwear, changing clothes after exercise, short rinse if there was intense sweating or contact with pool or seawater, general body hydration and avoiding dehydration with excessive alcohol or coffee before long days. No, baking soda paste, vinegar, lemon, hydrogen peroxide, chlorine, pure essential oils, dish soap, rough sponges, very hot water, scented deodorants or powders in the intimate area, homemade antifungal powders, bath scents applied to the skin, direct perfumes, mentholated creams or those with camphor on the glands or foreskin. Dr. Jocelyn, but baking soda worked for me once. I'm listening. What happened that time was probably that you mechanically removed accumulated residue and felt relief. But the price of that relief may be sensitized skin for the next opportunity. I don't want you to win once and lose 10 times. I want you to win all the time. Let's talk about specific situations and how to act without baking soda. If there is a persistent bad odor despite gentle hygiene, check two things. 1. Drying. Many times the problem is trapped moisture. 2. Fabrics, underwear, and very tight pants made of non-breathable materials. Adjust those two factors for a week. If the odor persists, observe the color and consistency of any discharge. If it is whitish, clumpy, and there is itching, it may be a yeast infection. If it is yellowish or greenish and smells strong, consult a doctor. None of these situations are resolved by rubbing with baking soda. If there are adherent white patches that come back, clean with warm water and gentle touches. Dry patiently, and avoid strong soaps. If they reappear, consult a doctor. They may be signs of balanitis that requires specific management. Baking soda here only burns and masks the issue for a few hours. If you have a foreskin that is difficult to retract, it won't loosen with baking soda baths. It is managed with gentle hygiene, patience, and in some cases, professional evaluation. Forcing with chemicals or violent contraction creates cracks that heal poorly. If you engage in intense physical activity, prioritize a post-workout shower, dry thoroughly, and wear underwear that doesn't trap sweat. You can carry a small pack of paper towels to dry folds if you can't shower immediately. This reduces bad odor more than any kitchen additive. If you use condoms or lubricants, rinse with warm water after the encounter, and, if you consider it necessary, a drop of mild cleaner to remove residues. Some people are sensitive to certain components of condoms or lubricants. If you notice systematic burning, switch brands or look for hypoallergenic options. Baking soda does not solve an allergy, it worsens it. If you live with diabetes or have low immunity, maintain modest and consistent hygiene. Avoid aggressive products and watch for any redness, pain, cracks, or discharge. Here, prevention is twice as important. If something doesn't improve in 24 to 48 hours, consult a professional. Now I want to explain to you with a metaphor why intimate skin irritates so much with aggressive homemade remedies. Imagine a varnished door that protects your house from the weather. If you want to clean it, you wipe it with a damp cloth, dry it, and that's it. If every week you use an industrial degreaser, yes, it becomes squeaky clean, but the varnish wears off, the wood dries out, and in a few months, it absorbs moisture, swells, and cracks. The glands and the foreskin don't have wood. They have a lipoprotein barrier that serves the same function. It protects, maintains the right moisture, and prevents microorganisms. Destroying that barrier leaves you exposed. The cleanliness that shines for 5 minutes isn't worth the deterioration that follows. To help you organize it effortlessly, I propose my 606 routine for men 60 plus, and for anyone who wants a simple guide. 60 seconds of care, 6 actions. Action 1, warm water for 15 seconds. Action 2, retract gently if appropriate. Action 3, remove residue with an open hand. Action 4, if needed, a drop of mild cleaner, not always. Action 5, rinse abundantly. Action 6, dry by patting and recover if there is a foreskin. You do this mini routine in your daily shower. If your day was sedentary, sometimes just warm water is enough. If there was sweat, a pool, the sea, or condom use, add the mild cleaner. If there was contact with urine from post-micturition dribbling, a short rinse and drying prevents odor and maceration. No baking soda. I know you want immediate results. I propose this honest 7-day experiment to show you that change comes without aggressive tricks. For a week, apply clean skin. No baking soda, vinegar, or perfumes. Choose breathable underwear. Each night, note 5 signals. 1. End-of-day odor, from 0 to 10. 2. Itching, 0 to 10. 3. Visible redness, yes or no. 4. Feeling of tightness after the shower, yes or no. 5. Overall comfort, from 0 to 10. If by day 3 you don't notice improvement, check the drying and the fabric. If by day 7 you are still the same, it's time to evaluate other causes. Fabrics, night sweat, medication, workplace irritants, or a condition that requires assessment. For a large number of men, the simple act of drying well and letting air out for a minute changes everything. For those who want a boost without harm, these supports do make sense. Support 1. Lukewarm shower, not hot. Very hot water strips protective lipids and sensitizes. Lukewarm cleans and cares. Support 2. Hydration of the body in general. I'm not referring to moisturizing the glands with creams if the skin is healthy. In most cases, it's unnecessary and can cause greasiness. I mean drinking water throughout the day. Well-hydrated tissues smell less and are less irritated. Support 3. Rest. Short sleep, reactive skin. Work on your rest routine. Healthy skin starts with a nervous system that is not on alert. Support 4. Extra underwear in the backpack. Changing after the gym or on hot days creates a before and after. Support 5. Hygiene after swimming in a pool or the sea. A brief rinse with fresh water, drying, and air. Chlorine and salt dry out. Don't add baking soda to that dryness. I want to share 3 brief cases to ground these ideas. Case 1. Joaquin, 64 years old. He tells me, I tried baking soda and felt relief instantly, but the next day it burned. We switched to clean skin. Warm water, pat drying, and cotton underwear. In a week, the odor went down from 7 to 2 out of 10, itching almost disappeared, and 0 burning. What changed? We removed the aggression and improved the drying. Case 2, Esteban, 52, an athlete. He was cooling off with direct air conditioning and very hot showers. He had recurrent white patches. Adjustment: warm shower, removal of scented cleaner, drying and airing for 1 minute. He stopped having plaques in 3 weeks. Never used baking soda. Case 3. Ruben, 71, with controlled diabetes, mild itching and odor by the end of the day. We applied a simple routine and retrained urination. Wait a few more seconds, shake gently, dry with paper if there is dripping. Odor improved and irritation decreased without homemade chemicals. Besides what to do, I want to give you what to avoid asking late. Warning signs that do not resolve with hygiene and require consultation. Intense pain, fever, or general malaise. Cracks or ulcers that do not heal quickly. Purulent discharge or bad odor that does not improve in 48 hours. Redness that spreads, shiny and hot skin, sudden difficulty retracting the foreskin or pain when retracting that was not present before, new vesicular or ulcerated lesions. There is no homemade method that is worth it here. Evaluation is needed. Hygiene accompanies. It does not cure infections or severe inflammatory processes. For those curious about safe, natural alternatives, I share a simple truth. Safety in the intimate area does not come from the exotic ingredient. It comes from gentleness and consistency. Warm water, clean hands, breathable fabrics, drying that does not rub. That is what natural that works. If one day your skin is sensitized and you want an extra bit of calm, a brief warm shower, followed by letting air in for 2 minutes before dressing, does more for your well-being than any miraculous powder. Let's talk about language. The way you speak to yourself when you take care of yourself influences how you feel. If you say to yourself, "This is a problem, I'm embarrassed, I need to hide it," your body tenses up. If you say to yourself, "I am learning to take care of myself with precision," your body cooperates. Intimate self-esteem is built with repeated acts of gentle care, not with chemical punishments. Dr. Jocelyn, is there any situation where baking soda is useful? In everyday male intimate care, I do not recommend it. Some traditional guidelines for warm sitz baths with very diluted additives have been explored in different cultures, but the evidence for using baking soda on the glands or healthy foreskin is not robust, and the risk of irritation exists. My role as a health professional is to suggest what adds value without costs, and what adds value here is to avoid it. I want to share with you now a guide of 12 silent mistakes that are often behind discomfort and that many mistakenly attribute to a lack of baking soda. 1. Very hot shower every day, resulting in dryness. 2. Scented men's soap applied directly, resulting in burning. 3. Rough sponge or glove, resulting in microcracks. 4. Not retracting and drying if there is a foreskin, resulting in maceration. 5. Synthetic and tight underwear, resulting in heat, sweat, odor. 6. Do not change after exercise, result prolonged moisture. 7. Perfume or deodorant in the area, result irritation. 8. Harsh drying, result redness. 9. Do not rinse lubricants or condoms, result irritating residue. 10. Direct water pressure on the glands, result hypersensitization. 11. Ignore post-micturition dribbling, result odor and maceration. 12. Try tricks every week, result confused and reactive skin. Correct these 12 and your need for something miraculous disappears. The change is immediate in sensation, genuine freshness, calm skin. For special days, trips, long days, very warm climates, I leave you a compact set for quick care. Unscented, softened paper towels, a small bottle of water for a quick rinse if there is no shower, spare underwear, a small space to air out for 2 minutes in a bathroom. No scented sprays, no powders. Discretion and consistency keep you comfortable. I also want to touch on the topic of age. In maturity, the skin loses some natural fat and becomes more susceptible to irritation. That's not bad luck, it's part of the life process. You become more skilled in details: water temperature, softness of touch, drying time. The reward is great: less discomfort, more confidence, and a kinder relationship with your body. If you live with mild incontinence or frequent dribbling, this guideline helps a lot. After finishing urination, wait 10 to 15 seconds. Perform a slight contraction of the lower abdomen accompanied by a slight lean forward. Shake gently, wipe with paper, and if you can, rinse with a few drops of warm water and dry. This small ritual reduces odor and irritation more than any cleaning additive. Before closing, I want to talk to you about something my patients appreciate: the gentle closure. After hygiene, place your warm hand on the lower abdomen for 10 seconds and take a deep breath. That gesture conditions the nervous system. Caring is not punishing, it is calming. You return to your tasks without a sense of aggression. It may sound subtle, but over the days, your body starts to anticipate that calm as soon as you open the shower. I'm leaving you a mini manual to remember in mantra format every time the quick trick tempts you. Warm water, gentle hand, soap if necessary, abundant rinsing, pat drying, breathable fabric. That is high-level hygiene. That is what truly produces an immediate real change. I want to share 3 more short, inspiring stories so you can see how consistency wins. Diego, 45. He had been trying everything for months. I asked him for a week without tricks, clean skin. 4 days later, he wrote to me, "I'm not itchy and I don't smell at the end of the day." He didn't change his life, he changed his method. Maurizio, 59. Itchiness after the gym. He switched to a lukewarm shower, quick rinse post-workout, pat drying, and spare underwear. End of the itchiness. Baking soda wasn't used. Alonzo, 67. He feared mild phimosis. He stopped forcing, cleaned to where it was comfortable, dried calmly, and requested professional evaluation. Micro injuries were avoided, and the process was resolved with strategy, not homemade chemistry. If I had to condense everything into one powerful sentence, it would be this: the best immediate change doesn't come from rubbing with baking soda, but from washing with warm water, rinsing well, drying patiently, and wearing breathable fabrics. The rest is noise that irritates. It's never too late to regain vitality and confidence through daily care. If today you turn off the myth of baking soda and turn on the precision of clean skin, in a week your skin will notice it, your mood will appreciate it, and your intimate health will celebrate it. If this content gave you clarity, put it into practice and tell me in the comments what changed in your first 7 days. Did the smell decrease? Did the itching disappear? Do you feel more comfortable at the end of the day? Share this video with anyone who is still trying tricks that only cause harm. And subscribe if you want to keep learning natural, safe, and effective habits for male well-being and maturity. I am Dr. Jocelyn, and I am honored to accompany you on this path of smart care, where respect for your body is worth more than any passing trend.